I am really not looking forward to going to work tomorrow because Fridays, as far as I'm concerned, and what I call it, is IPP Fridays. IPP being penile implant Fridays. We have a doctor who is making boku money. I don't know what he's telling his clients, his patients, or whatever, that's causing all these men to come in and have a selective procedure, elective, selective, whatever procedure, of a penile implant. And most of these guys are usually between the age of like 60 to about 85. Now, people, 85, what are you doing getting a penile implant at 85? I mean, around that time, you should be like going out with your wife, your girlfriend, or whatever it is, traveling, seeing the world, looking at the sights, going on vacation, just enjoying life. Because, not to sound mean or anything, but it's pretty much a done deal, and especially you should be trying to, I don't know, get closer to God, or, all these little other things that I would think that you would be doing at 85, not thinking about sex, not being so consumed by sex that you would go and get a penile implant at 85. Now, there are a couple of patients who I can understand that based on certain conditions that they have certain, like high blood pressure. They may also suffer from diabetes. And those two things alone could really just mess up your possibilities of, having an erection normally. And also some medications that you end up taking for all of these different conditions can lead to the possibility of impotance. Yes, I understand that. But at the same time, it's like, you're 85, like, be serious. Like, how much action do you really think you're going to be getting? So, it's a little chaotic for me on Fridays because I'll start off with my normal amount of patients, and usually doctors on Friday try to get as much patients out as possible because, they have to go on vacation, go golfing, go on the yacht, do the little thing or whatever. They don't really want to be bothered on the weekends. So, they try to get rid of the majority of their patients on Friday, and then I'm stuck with like maybe 3 or 4 patients. The next thing you know, here comes this doctor coming through with about 15. These are large numbers. This is like 15 to 20 patients coming in through our operating room to have this procedure done, and they usually end up going the next day. Now, what usually happens, there's 3 different types of penile implants that you can have, and it's all based on what your preference is, or also what your finances look like. And it's pretty basic, pretty simple. They usually have like a little scar up on top of their pubic area, and because that's where they did the operation and everything. And then in their balls, I guess you would call it, there they have their little device where they can just and get themselves a nice little erection. And if it's a little too high, they can put it back down a little bit, and they can move with it, and it's like Play-Doh, really. Like, it won't come down, because once it's inflated, it won't come down, but it'll come up. You can have it curved to the side, curve up. It's crazy. And the majority of doctors say, you can't have any kind of activity for about 4 to 6 weeks. But be serious. You think that they got this done, and they're actually going to wait a month to a month and a half before they use it? And that's when the little sorry asses come back with an infection or some kind of malfunction or something, because no one wants to listen to doctor's order. They got it. They want to, it's a brand new toy. They want to ride in it. Just like they got a brand new car, you know, they want to take it for a ride. You're not going to tell them, well, I just gave you this brand new car, but you can't drive it for about a month or a month and a half. Be serious. Like, no one's going to follow those kind of directions. Not when, obviously, you got it because you're on a horny attack and you want to go doing your thing. To have to put it off for another month, month and a half, no one's really going to follow those directions. So they always tend to come back with some kind of complications. Sometimes it may not be that soon, and maybe like 2 or 3 years down the road, but some usually come back. The ones who don't listen, the ones who use and abuse this brand new car that they have. But I mean, I like Fridays because it guarantees that I'm not gonna get, you know, that little phone call in the morning talking about, oh, well, I'm sorry, we don't have that much, you know, our census is not that high, so we're gonna have to cancel you, because I know that this doctor is gonna roll in with about 15 to 20 patients with this kind of procedure done, so I'm not getting canceled. Going to work tomorrow is a guaranteed. But at the same time, it's like, you know, and then they get so eager, they want you to see it, and it's like, I don't want to see it, you know. I mean, I know what it looks like. I've looked at one or two before, and I already know what they look like. I know what it feels like. I know everything about it. So yours is no different than mine. All I want to do is see if you're, you know, if you're bleeding or any certain problems, if you're not urinating. That's what I want to know. Other than that, I don't need to see your equipment. I don't need to see you pump it up and pump it down. No. You just keep that right there under your gown, and we'll just focus on the main important things that will get you home tomorrow. Oh, Lord. I gotta go. The baby is crying. My niece.